Hello everyone, good evening. My name is Dr Tanima Singhal and I am a lactation consultant, doctor, childbirth educator and a Garbh Sanskar expert. I have 12 years experience in obs and gynae. My graduation is in Ayurveda. Since 3 years I am practicing as a childbirth educator and a lactation consultant. So today's live session topic is how to express and store breast milk when the baby is in NICU. So I get a lot of calls from mothers that if the baby is in NICU, can I still breastfeed my baby? Or when the mothers usually visit, sometimes when they visit in after the baby is 1 month old or 2 month old, and they give me a history that the baby was in NICU, so I couldn't breastfeed my child initially. So this video I am making so to create awareness that if the baby is in NICU, how can a mother store her breast milk, express and store her breast milk if she is not allowed to directly breastfeed the baby. You can contact your doctor and ask your pediatrician that if the mother can directly breastfeed her baby when the baby is in NICU. So if you get permission to directly breastfeed your baby, then that is very good. If suppose you don't get that permission, if the doctor doesn't allow you to feed the baby directly, what you can do, you can express and store that breast milk, and then you can give that in NICU so that the sisters there, the nurses there can feed that expressed breast milk to the newborn baby. Now how to do that? So how to express breast milk, first we'll understand that, and then we'll understand how to store it. So for expressing breast milk, what all things are have to be done? Like mother can have drink little warm water before going for expression. Then she has to think of her baby. This will help in oxytocin letdown by spelling the clothes of the baby. Also I read it somewhere and I found it very beautiful thing that what they used to do, they used to have a cloth which the mother used to touch to her skin, and they used to keep that cloth near to the baby if the baby is in NICU, so that way the baby gets smell of her mother, though that is very good. So you can even do that. So I read it somewhere, so I found it good, so I thought of sharing with you all. So you can do that. So after with smelling the baby's clothes, the mother, her oxytocin reflex works good, so that way her milk will start coming down. Then she can do circular massage on the breast, and then she has to do some hot fermentation or hot compress so that the milk supply is established. Then she can express the milk, and then she can store it. Now expressing the breast milk, three techniques are there, which is press, compress and release. This is the technique of expressing breast milk manually with hand, and it is very easy to do that. People go for breast pumps and all that, but I would like to tell you, you can effectively manually express the breast milk, even that is very effective. Now how to store the breast milk? First of all, you should understand where to store it. Don't store in any kind of plastic bottles, whatever good plastic it may be, but it is a plastic. So you have to store the breast milk in either a steel container or a glass container. That container should be wide mouth, so that if you have to take out the if you have to take out the breast milk, it is easier for you. So how to prepare that vessel? You have to first clean it and then boil it in water for at least 10 minutes and then air dry that. So after with air drying, the container will be ready to store breast milk. So the expressed breast milk has to be stored in either a steel container or a glass container. Now how can you store it? If suppose you are able to send that fresh, that will be very good. But sometimes what happens, the baby is in NICU and mother is discharged, so mother is at home, or if the mother is in different hospital and the baby is in the different hospital, it becomes difficult to reach out the fresh breast milk to the baby. So in that case, if the mother has to store the breast milk, then what all are the conditions, we will discuss that. So if the expressed breast milk is stored in fridge, in the refrigerator, under clean conditions, it can be stored up to 7 days. Okay. And but you have to always ensure that the refrigerator is kept cold consistently. You have to keep the refrigerator cold consistently so you can store the breast milk for 7 days. Now, if the breast milk has to store for at room temperature, then what has to be done? If suppose the mother is in a hospital and she doesn't have a refrigerator in the hospital, then how she can store it in room temperature? Okay, then understand. Either you can buy a earthen pot and just hang that bottle inside the earthen pot so that it is cool, and otherwise you can have a vessel filled with cold water and you can keep the express breast milk glass or steel bottle inside that cold water, so that will keep the temperature of the breast milk lower side. And this kind of storage can be, if this kind of storage is being done, so the breast milk can be stored up to 6 hours. So that will be good. If suppose the mother is in different hospital and the baby is admitted in an NICU, then within 6 hours that milk can be transferred from one place to another. Suppose it is stored at one place, then you can put it either in a earthen pot or vessel filled with cold water as I explained. And suppose you have to carry it, then if you have to carry, then you can take a cold bag or a ice box with deep frozen ice packs. That ice packs need to be changed in 24 hours. So if somebody has to carry that express breast milk from one hospital to another, then they can keep it in the ice box with deep frozen ice packs. So that way the milk will remain safe and will be able to carry it from one hospital to the other. In that way, the mother's breast milk can be taken to the baby if the baby is in an NICU. Now, that fresh breast milk, now some people may be asking that breast milk, how can it last for so much hours at room temperature or at normal conditions? Fresh breast milk has infection fighting factors which keep it safe. So that way it will be good to use if it is kept stored in the way as I am telling you right now. Now, frozen breast milk in freezer can last for 2 weeks. And suppose you have because the light, you have to also see that the electricity supply is regular. If you have a deep freezer and you have separate freezer where you can store the breast milk, if you are putting it in a clean conditions, then separate freezer you can put the breast milk, store the breast milk for good 3 to 6 months. So that will be very good for a mother to keep a stash, which will be helpful in the later months when the baby will have growth spurts or the baby will start increasing her weight gain. So that time babies will be demanding more. So that time that stash can be used. Even after 6 months, if the mother is wishing to join her office back, she can use this stash breast milk which she has stored in the first 6 months. She can use that breast milk when she starts going to the office. So this way you can ensure that breast milk can be available for the baby as long as she wants. So these are the ways where you can store breast milk. I hope this information was good, and for NICU babies, breast milk is very important. I have talked to so many doctors, so many pediatricians. They all say if the baby gets breast milk of her mother, and the baby is in NICU, if the baby gets a breast milk from her mother, that will be very helpful. So that will get a good recovery of the baby. So I hope this information was helpful. If you like the information, please pass on this information to any pregnant lady or a new mother you know. So that will be helpful for them to store breast milk and use it for their future needs or for the present needs. Thank you so much. Just stay connected. I am taking topics related to breastfeeding every Sunday at 4 p.m. sharp. Very soon I am coming up with topics related to parenting, child nutrition and pregnancy care too. So just stay connected every Sunday 4 p.m. Take care. Have a nice day. Bye-bye.